Patrick Hutzel from IntensivCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from our readers, and the question last week was, my daughter is critically ill in ICU. Are they limiting treatment for her to end her life? Help. You can check out last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer questions from one of my clients, Ashanti, as part of my one-on-one consulting and advocacy. Ashanti's dad is in ICU with a stroke and is on a ventilator, and Ashanti is asking why they are in a hurry to push him out to LTAC. So today's episode is, my dad is 5 days in ICU with a stroke and is ventilated. Why are they in a hurry to push him out to LTAC? So Ashanti writes, hi Patrick, my dad, who is 91 years old, currently in neuro ICU for 5 days, due to brain hemorrhage. He was admitted last Thursday to the hospital due to shortness of breath. He was also tested positive for COVID. He was feeling better for the first 4 days until Tuesday. He was on blood thinners like aspirin and given Levodopa injections to prevent the stroke. But due to his fluctuating blood pressure and combination of these medications, he developed brain hemorrhage on Wednesday afternoon. He got disoriented and could not communicate as before. Based on the MRI scans, doctors gave medications to stop bleeding. It stopped for a brief period on Wednesday afternoon, but the bleeding worsened and the cardiologist put him on the ventilator with a breathing tube. He was sedated as well, along with blood pressure medication, so that bleeding did not worsen. Now he's paralyzed on the left side due to bleeding on the right side of his brain. On subsequent scans, bleeding had stopped and he was hemodynamically stable for the past few days, but he is very drowsy, occasionally waking up. He's not on sedation for the second day. Respiratory therapists tried the spontaneous breathing trial for yesterday and today, and it was not successful, so continued on with ventilation support. I presume that they are going to try in the coming days as well. Hope this would progress well so that he could wean off ventilation support. His ventilator settings as per the nurses seems to be on the lower end, tidal volume about 400 mils per breath. Due to COVID restrictions, I cannot be on his side during this very tough period. Sometimes I feel very helpless, but only after watching your videos could I feel comfortable only getting updates through the phone. He has a feeding tube inserted through the mouth. On the improvements positive side, he has not been sedated for the past few days. Vitals are stable, IV medications have been reduced and stopped. All the medications are powdered and given through a feeding tube. For other updates, they have done the spontaneous breathing trial for him before they decide to go with a tracheostomy as the next step. I know there are many risks with tracheostomy, but it's a safe procedure for critical care patients, and I hope due to his old age, he will be able to withstand it. The doctors were negative from the start and earlier trying to convince me about his body not able to withstand the pain going through the tracheostomy, but I was insisting on providing him all the care needed. I hope the brain bleed gets absorbed in the body in the coming weeks as mentioned by the doctors and the nurses. I also hope that my dad is progressing in the right direction and hoping that his condition will get better so he could be weaned off the ventilator support. As he is very old, severely debilitated, he might need rehabilitation care once he's weaned off his ventilator and moved out to ICU to a regular hospital room. I also wonder about his quality of life after this episode. Earlier, doctors and others were discussing palliative care and eventually moving him to LTAC as well. They mentioned as we progress, they have to go by the hour and day. I know it's a long process to come out of from this situation. How best to handle this period, as I feel very anxious and sad at times, awaiting for your replies and further course of action. Also aware of the risks about long-term acute care, also known as LTAC, once he's out of hospital ICU. I'm really very interested about your service. Thank you so much, from Ashanti. So here is my response to this email. Hi Ashanti, thank you for giving the details of your dad's current situation. So the primary reason your dad is in ICU is not COVID, it's the stroke, and he has been in ICU for only 5 days. So looking at the quality of life when patients survive intensive care, you don't know what the quality of life looks like in 6 months' time. So you really got to break your goals down into steps. I guess at the moment the goal is to get your dad out of intensive care alive. We don't know what that looks like. We don't know, does he need a tracheostomy to get out of intensive care alive? Nobody knows at this particular point in time. Whether he can come off the ventilator or he ends up with a tracheostomy, nobody knows at the moment. The easiest way would be to get him off the ventilator without a tracheostomy. That should always be the goal. Here's the thing, if someone can't come off the ventilator with a breathing tube after 10 to 14 days, then a tracheostomy needs to be considered if, for whatever reason, either the patient or the family doesn't want a tracheostomy. Well, you could argue, let's stop treatment and let's look at the end-of-life options, but that is still your decision, it's not the hospital's decision. Your dad is only 5 days in ICU and you have to ask them, why are they in a hurry to move him to LTAC or long-term acute care? There's no rush to let people die. LTAC is a better version of a nursing home and we strongly oppose sending patients to LTAC because of the risks involved. Ashanti, you also need to ignore the negativity. They are negative all day long for their own very good reasons. Watch what they're doing, don't watch what they're saying. As long as they're treating your dad, this is way more important than them being negative. So then Ashanti writes back, "Hi Patrick, it was really good speaking with you yesterday. Thank you also for your email. Today I happened to discuss with one of the intensivist doctors at the hospital. She was saying like weaning off a ventilator is going to be difficult as he is in a limited consciousness state. He cannot handle his secretions. She was giving me options of whether my dad would like to have a tracheostomy and then weaning and then moving to LTAC nursing facility, and he's only 5 days in ICU. I'm very frightened and concerned that medical professionals are rushing to move him out of ICU in this condition. Let me know how and when we could have our next call." From Ashanti. So here is my response to Ashanti. Hi Ashanti. Look, the first thing that stands out to me here is Ashanti is 5 days on a ventilator is not a long time. So moving someone to LTAC after 5 days in ICU on a ventilator, from my experience, is inappropriate and not clinically safe. If you came to me 5 weeks, I would say, okay, all right, what's happened in those 5 weeks? 5 days is not a long time, full stop. So let me explain this to you steps forward. LTAC, from my experience, is inappropriate at this particular point in time. As I said to you, if you came to me, oh, it's been 5 weeks, he's still on a ventilator, he's not waking up. Okay, well, let's reassess the situation. But for someone that is only 5 days in ICU, well, that's really inappropriate. The question with a tracheostomy is really, if he can't come off the ventilator in the next 10 to 14 days, then a tracheostomy might be the right thing to do. If you feel they're pushing you towards palliative care or LTAC, I wouldn't get pushed at all, because that might be the end of the life for your dad. Anyway, let me ask about his consciousness state. What is his GCS or Glasgow Coma Scale? It's a clinical tool used to reliably measure a person's level of consciousness. Please see the link below for a detailed description of the Glasgow Coma Scale. We've linked below this video in the written version of this blog. You can also send us pictures of your dad's ventilator, the monitor, his most recent arterial blood gas and chest x-rays. Is he on any sedation? Is he on any inotropes or vasopressors for low blood pressure? Going forward, Ashanti, I believe I can help you. One way I can help you with is certainly by giving you a second opinion and talking to the doctors and nurses with you. I do believe that would be very helpful, because I argue that they always tell families only half of the story. So they're telling you he should go to palliative care, he should go to LTAC. If you and I were on a call with the doctors, I would ask them a series of clinical questions, and I would ask them, well, have you done this? Have you done that? So at the moment you are in a position where you can't ask all the questions. I've worked in the environment for over 20 years. I can just rattle off some questions and they know, okay, they have to tell you the full story. They have to be transparent. Then Ashanti writes back, "Hi Patrick. Thanks Patrick for your email and for sending the Glasgow Coma Scale article from your website at intensivecarehotline.com. As per my dad's current situation, he seems to be a GCS scale of 5 or 6. Not sure about his status entirely. As per one article, they are mentioning that 8 and below are comatose, low-level consciousness, vegetative state. It's someone not clear to me to classify. Also, I would try to get a picture of his ventilator settings. For arterial blood gases, they seem to check on his CO2, carbon dioxide, and it seems to be okay as per the physician, and they want to do another procedure or something to check it. Chest x-ray seems to have no change. He's not on any sedation. I will check whether he's on vasopressors or inotropes. Also, as per the intensivist doctor, they are planning to do a tracheostomy tomorrow for my dad and then subsequently do a procedure to insert the tube into the stomach instead through an oral tube. Now, hopefully these are safe and appropriate to perform for my dad's recovery process from Ashanti. Here is my response. Hi Ashanti, they are safe procedures generally speaking. However, the aim should still be to get your dad off the ventilator and avoid the tracheostomy and the feeding tube in the first place. I do believe that a picture of the ventilator and a full arterial blood gas result would gauge whether he needs a tracheostomy or not. Having said that, with a Glasgow Coma scale of 5 to 8, he wouldn't be in a position to avoid the tracheostomy at present. Ashanti writes back, Hi Patrick, they are not trying to just wean off the ventilator without a tracheostomy. Today is the 8th day on ventilation support. He seems to have done spontaneous breathing trials for about a couple of hours for the past 5 to 6 days. Do you think they have to delay the tracheostomy? They are making plans to do a tracheostomy tomorrow and a feeding tube the following day. Is this a good approach for him going forward, as he is minimally responsive and not having much success with the straightforward weaning off process? I will try to get a picture of his current ventilator settings. Thanks and best wishes from Ashanti. Here's my response. Hi Ashanti, if they do a tracheostomy this quickly, they might want to send him to LTAC, which is going to be very risky for him. If you've done any research about LTAC, you would find very negative reviews and feedback about LTACs online. You can send us the picture of his current ventilator settings. Ashanti writes back, Hi Patrick, they have already done a tracheostomy today. They were mentioning that tomorrow they would be doing a feeding tube procedure. They also mentioned that they would continue with ventilator weaning with tracheostomy in the coming days. Also, the feeding tube is also known as a PEG tube, percutaneous endoscopic gastroscopy tube. It makes me concerned. They also mentioned about 24 hours skilled nursing facility. Please let me know as to whether we are going in the right direction. As one of the nurses mentioned, as now ventilation settings is back to 100%, as he just did a tracheostomy. Thanks and best regards from Ashanti. My response, Hi Ashanti, if they're moving him to a skilled nursing facility, you need to object. Weaning sounds good, you need to make sure it's actually happening. Trust, but verify. Ventilation is back on 100% of support because he has been given general anesthesia during the tracheostomy procedure. It should be temporary only, let's keep monitoring. Ashanti writes back, Hi Patrick, thank you so much. As of now, they are not moving out of the hospital, but one of the hospital case managers discussed today afternoon about my dad's long-term care options. I mentioned that I don't have anything in mind and could send me some options to my email address. I had mentioned that he has to be continued with weaning and any neurotherapy needs to be done, and it's early to discuss at this point. Also, the current place he's staying is not capable of providing the needed care. I will further update you. Best regards from Ashanti. My response. And then Ashanti writes back, Hi Patrick, my dad completed both procedures, tracheostomy and PEG tube. PEG again stands for percutaneous endoscopic gastrostomy and is a feeding tube in the stomach. He seems to be doing okay. They are trying to wean him off the ventilator by doing daily spontaneous breathing trials. But my dad seems to tolerate it only for some time. Today, on interacting with one of the nurses, I got the ventilator settings. They hesitated to send out the pictures of the same. PEEP is 6, FiO2 35%, respiratory rate 16 breaths per minute, tidal volume around 400. As per the ICU team, this seems to be set on the lower side. Dad is still not fully awake and responding to oral commands and signs. They seem to not be doing any other neural stimulation or therapy of any sorts as of now. How long is the weaning process? Would it take weeks to make some meaningful progress in my dad's case? As per interaction with them, I would guess they are inclined to move him out of the ICU sooner if he's stable and continues the weaning process and then discharged to LTAC. Based on your previous experiences, please share some insights and guidance further. Here's my response. Hi Ashanti, the numbers look good with PEEP of 6, FiO2 of 35%, respiratory rate of 16 breaths per minute and tidal volume of 400. What ventilation mode is he in? Are the 16 respiration rate per minute spontaneous, machine delivered, or a combination of both? This is where the rubber hits the road. Please find out. Weaning can take from days to weeks or months. It sounds like he's making progress, but please find out the ventilation mode he's in and also find out if there are any recent arterial blood gases. Physical therapy and mobilization is not optional. It needs to happen. We need to know as well if his vital signs are all stable and that he's not having any temperature. Here's Ashanti's response. Hi Patrick, thanks for your prompt reply. Based on my interaction with the nurse tonight, his respiration rate of 16 seems to be a combination of spontaneous and machine delivered. Though they seem not to have done any spontaneous breathing trials today. They mostly would be doing one tomorrow. His vitals seem to be okay. Not on any IV medications. He seems to have loose bowel movements due to his feeding tube for the last 12 days. Also had a low-grade fever of 99.1 Fahrenheit. These seem to be minor in nature. They did a chest x-ray this morning, no significant change from his COVID pneumonia that was existing before. As per our conversation 5 to 6 days back, his COVID-related biomarker seems to be coming down. In his routine blood test, this could be confirmed again tomorrow. Let me know your thoughts. My response, hi Ashanti. He will only be able to come off the ventilator if he can breathe spontaneously. The ventilation mode before extubation is called CPAP or pressure support. Keep asking for the following. What is the ventilation mode? What is the ventilator PEEP? How much pressure support is he on? What are his tidal volumes? What are his minute volumes, the volume of air that can be inhaled or exhaled from a person's lungs in 1 minute? And it's usually a result of breaths per minute times tidal volume for breaths gives you the minute volume. What's his ventilation FiO2? What is the result of the most recent arterial blood gas? Does he have a good strong cough? How frequent are they suctioning him? Is he obeying commands? Can he swallow? For further reading and as a guiding article, you can click on the link from our website at intensivecarehotline.com, how to wean off ventilation and tracheostomy step by step. So that concludes today's one-to-one consulting advocacy session, and it will continue in next week's episode. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. You will get crucial behind-the-scenes insights so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care. And it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again in another update next week. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership for families in intensive care at intensivecaresupport.org. There you have access to me and my team 24 hours a day in a membership area and via email. Also, you can call me. Find phone numbers on the top of our website. If you want a medical record review, please click on the link again below this video in the written version of this blog. Contact us for a medical record review. If you have a loved one in intensive care that needs a medical record review, or after intensive care, we can help you with that as well. And check out our ebook section, and you can get one-to-one consulting and advocacy with me over the phone, via Skype, via Zoom, via WhatsApp, and via email by clicking on the relevant tabs on the top of our website. And subscribe to my YouTube channel. Give the video a like, share it with your friends and families, click the notification bell, and comment below what you want to see next. Thanks for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days.